The World Health Organization says 3 people have died amid a suspected outbreak of hantavirus on a cruise ship sailing the Atlantic. The outbreak was reported aboard the MV Hondius, which was sailing from Argentina to Cape Verde off the coast of West Africa. The WHO has confirmed 1 case of hantavirus with 5 more potential cases under investigation. The MV Hondius is currently just off the coast from Cape Verde's capital, Praia. Let's bring in Owais Durrani. He's an emergency medicine physician and also a medical analyst. Welcome to DW, Dr. Durrani. So for our viewers who may not be familiar with this infection, what exactly is a hantavirus?
Yeah, absolutely. So a hantavirus is a family of viruses that rodents carry. And usually how humans become exposed to it is through rodent droppings, urine, or saliva. And so a lot of times it'll be in the dust and maybe you're cleaning and it kind of goes into the air, you inhale it, and that's how you get infected. Of course, if a rodent bites you, that's how you can become infected as well. If you recall last year, the famous actor Gene Hackman's wife had passed away from this. And so that's when a lot of us heard of it in the public kind of sphere. Usually when you get it, the initial symptoms are flu-like. So you're going to have like body aches, fatigue, fevers, you're going to be tired. When it becomes really dangerous is when it advances to something we call hantavirus pulmonary syndrome. And so that's a fancy word for essentially you have lung damage and your lungs fill up with fluid, you have difficulty breathing, and you need to go on a ventilator. Unfortunately, when it does get to that point, the mortality rates do increase. And it is something where we don't really have a cure for it. We only have supportive care. So things like putting you on a ventilator, helping your lungs recover, that kind of thing.
Well, it does sound rather frightening. Should people be worried about this? I mean, just how high of a risk is it to contract a virus like this?
Yeah, so I don't want to cause panic. This is something that is extremely rare. For example, in the United States, throughout the entire year, last year, there was around 800 or so cases. So when you compare that to other viral and bacterial illnesses, it is a minuscule number. So not something to be panicked about, but something to be aware of if you live in a region where this is something of higher prevalence, right? So where this ship sailed from, that is an area of higher prevalence. There are certain parts of the United States, like New Mexico, where there is a higher prevalence. So if you live in one of those areas and you start to feel some of these symptoms and you aren't sure what it is, those would be reasons to immediately seek medical attention, because obviously the earlier you see a doctor, the better chances you have at a recovery.
All right, so since this is a virus linked to rodents, when we hear about an outbreak like this on a cruise ship in the middle of the Atlantic Ocean, what are the first hygiene or sanitation failures that we need to wonder about?
Yeah, absolutely. So we hear about outbreaks on cruise ships and ships in general a ton. And that is because they are environments that are very likely to kind of foster that kind of environment, right? So you're out at sea for a number of days. You have limited space. If someone does get sick, there's not a lot of space to kind of quarantine or isolate them in. And so right now, the questions that need to be asked are, where did that exposure happen? Usually this virus, the majority of the strains are rodent to human. There are some rare strains that actually originate in the place where this ship sailed from that can be human to human. So I would say that's probably the first question that needs to be answered. Was this human to human transmission or human to rodent? Then a bunch of contact tracing needs to happen to ensure that these humans, who did they interact with? Were they exposed? How are they doing? And then the ship itself, right? Every area has to be inspected, from where the passengers are to where the crew is to where the food is stored. And once again, kind of asking that question, where did this exposure occur and how do we prevent it from kind of continuing?
Right, so I imagine that those are steps that local authorities or officials at the cruise company might be undertaken, but we also have heard that the WHO will be launching an international investigation. So what kinds of steps would you expect global health authorities to take?
Yeah, and that is such an important point, and why organizations like the World Health Organization are so important and why they need to be funded. Because a situation like this is, not under the jurisdiction of any one country or company. It involves various nationals, various locations, and the only folks that can do that are organizations like the WHO. And so they're going to be the ones that can truly do that contact tracing. That's a word that we use a bunch during the early days of COVID, right? Someone got COVID and we would try to figure out who were they in contact with so that we can check on those people. people. Same thing here, especially something that is highly contagious, something that has a high mortality rate. They're going to be the ones that can figure out, which country did this originate in, or is it in other countries, working with those public health authorities in contact tracing to ensure that this is not spread further. And then, of course, answering that paramount question of, was this possibly a strain of human-to-human transmission? Because that would require more resources and even more scrutiny when it comes to contact tracing.
And if we want to look ahead, what lessons do you think cruise operators should be taking from this incident to prevent something similar happening in the future?
Yeah, absolutely. So, I'll kind of address it from if I'm someone who maybe is about to go on a cruise, right? I would kind of look at the cruise company and say, hey, what are your health protocols? What happens if there is an outbreak? Because, a hantavirus outbreak is rare, but things like norovirus or other viruses, those are much more frequent. So what are your procedures in place when an outbreak happens? What kind of medical personnel do you have on the vessel? Can I be evacuated if I get sick? Those would be the first kind of questions I would answer to the cruise operator and the cruise company. And they're going to be the ones that need to ensure that those things are in place, and they're going to respond to their customers, right? And so if a customer doesn't ask those questions, maybe they don't pay as much attention to it. If 80% of the customers are asking that question, then they're going to invest in those resources to ensure that we're safe. Also, if you're about to go on a cruise, make sure your vaccines are up to date, and then make sure you have all your medications and medical history. So if something does go wrong, they have the best chance at treating you.
Dr. Owais Durrani, thank you so much for all of your insights. Really interesting stuff there. Many thanks.